How do imaging tests detect early bone cancer? Imagine catching a problem before it becomes obvious. That's exactly what imaging tests aim to do when it comes to early bone cancer. They look for subtle clues in the bones that might not cause symptoms yet but could signal something serious. The process usually starts with an X-ray because it's quick and accessible. An X-ray can show changes like unusual masses or irregular areas in the bone that might suggest a tumor. But sometimes, early bone cancer doesn't cause enough structural change to be visible on an X-ray, so more sensitive tests are needed. One of these is a bone scan, also called skeletal scintigraphy. It involves injecting a tiny amount of radioactive material into the bloodstream. This material travels through the body and collects in areas where the bone is more active or undergoing change. Cancer cells in the bone can cause increased activity, which shows up as bright spots or hot spots on the scan. Bone scans are very good at detecting early metabolic changes across the entire skeleton, making them useful for spotting problems before they show up on X-rays. Magnetic resonance imaging, or MRI, is another powerful tool. It uses magnetic fields and radio waves to produce detailed images of both bone and surrounding soft tissues. MRI is especially good at detecting early involvement of the bone marrow, which can happen before any bone destruction is visible. It also helps doctors see how far the tumor has spread into nearby muscles, nerves, or blood vessels, which is important for planning treatment. Computed tomography, or CORT scans, give detailed cross-sectional images of the bones. They are better than X-rays at showing small changes in bone structure and can reveal subtle areas of destruction or abnormal architecture. Doctors often use CORT scans after initial suspicion to get a clearer picture of what's happening inside the bone. They also help assess the risk of fractures and check for metastases in the lungs, which is a common site for bone cancer to spread. Positron emission tomography, or PET scans, are unique because they look at how active the cancer cells are. They use a radioactive sugar called FDG that cancer cells absorb more than normal cells. PET scans can find active cancer sites throughout the body, including in bones, even before any structural damage is visible. When combined with CORT in a PET CORT scan, they provide both the metabolic activity and precise location of the tumor, giving a comprehensive view. In summary, detecting early bone cancer with imaging involves looking for signs of abnormal bone metabolism and early structural changes. Bone scans and PET scans are especially good at catching metabolic activity early, while MRI and CORT scans provide detailed pictures of the bone's structure. X-rays are helpful as an initial screening tool but might miss very early or subtle signs. Using these tests together allows doctors to find bone cancer sooner, understand how far it has spread, and plan the best course of action. Remember, imaging results are just one piece of the puzzle. A biopsy is necessary to confirm the diagnosis. If you notice any unusual bone pain or symptoms, it's important to consult a healthcare professional who can guide you through the appropriate tests and care.